Dr. Fankhauser, let's talk a little bit about teeth cleaning. You know, which brush to use, soft one, hard one, flossing, any particular, you know, like electrical brushes better than non-electrical brushes? Is there anything we should pay attention to in the toothpaste, fluoride or not, this or that? Even on the floss, are the waxed ones better than other one? You know, which movement should we use? Please give us a little rundown on that whole thing.
All right, I'll try to. Okay. Well, in the first place, you want to use the end of the brush that has the little bristles on it. And we have always, as long as I can remember, recommended a soft brush so that you're not doing damage to the gum tissue or the teeth, especially along the root surfaces. We find, though, that really using an electric brush, either one of the vibrating kind or the little Sonicare type, people do a better job cleaning their teeth with an electric brush. So we do recommend that highly. They do wear out too, but and as far as floss, I don't know. I don't really have that much of a preference on it. It's kind of whatever you like the best. But only floss the teeth you want to keep.
Oh, wow. Well, that makes it simple. You know, that means that only floss the teeth you want to keep, huh? I see. And, you know, in flossing, any particular attention, like, you know, should we put lots of attention on putting lots of pressures on the gum upstairs and massage it, or is it more the side of the teeth which counts? And with brushing, should we brush the enamel only, or should we do, you know, again massage by brushing the gums quite a bit? You know, where's the important part here?
Well, when I actually get down to it, I'm talking with a patient about it. What I tell them is to forget about brushing their teeth and just brush your gums, where the teeth and the gums come together. That's the area where we see most of the damage. Most of the damage occurs where the tooth and gum comes together or in between the teeth. So flossing in between the teeth removes bacterial plaque that is depositing acid in between the teeth and eating holes in the teeth. So, or it could be doing gum disease, gum damage to the gums and the bone. So
I guess that's why you have to.
You don't have to do it hard.
At that 45 angle, kind of try to go in between. No different when with a broom, we try to lift the carpet a little bit and we hold the broom in an angle to kind of clean it in between the floor and the carpet, right? That's what you say is the important part, right?
45-degree angle, and you know, and then go. Another good recommendation is to go. Start in one spot, and then go all the way around the arch on the outside, then come around on the inside, go all the way around, so you get back where you started. Okay, that way you don't miss places around the teeth. Don't jump around here and there and try to get it all, and then, you know, just stay sequentially. See? So it's good not to miss any places.
Okay. Well, yeah, I assume so. Well, okay, good. So, what about toothpaste? Any preferences on toothpaste? Is this fluoride stuff a good thing, a bad thing, an unnecessary thing? What should we use there? Natural stuff, just plain soap, nothing. Some people say only just use water. I don't know. I mean, what's your take on it?
Well, in the old days, they used to use baking soda and peroxide, or I even remember people who used to brush their teeth with salt, just in the palm of their hand, and wet the brush and brush with salt. Of course, if you don't get heart disease from it, it works really well on the teeth. But anyway, toothpaste really depends on your situation. Do you get a lot of cavities, or do you have gum problems? If you have gum problems, then you need a different kind of toothpaste than you do if you tend to get cavities. So fluoride is good for the cavities. There's other preparations that we would use for the gum disease part. So it kind of depends on which side you lean to. If you're kind of right in the middle, you get both, then there's combination things for that.
I guess just brush him often regularly, floss him often regularly, and then maybe go and do your checkups and your cleanings, and you most likely looks like in the end you're just fine.
Yeah, if when you're seeing the dentist, if you have a question about the toothpaste, the brush, or floss, bring that up, and we'll be more than happy to discuss it with you.
Okay. Well, thanks a lot, Dr. Fankhauser.